Hello again. Welcome back. Today, we'll continue our discussion on respiratory disorders, diagnosis, management, and prevention. Our topic for today is restrictive lung disease. We'll be talking about the pneumoconiosis. The pneumoconiosis are a group of interstitial lung disease caused by the inhalation of certain inorganic dust particles and the lung tissue's reaction to the dust. The principal cause of the pneumoconiosis is workplace exposure. Environmental exposures has rarely given rise to these diseases. They are called occupational lung disease. Pneumoconiosis usually takes years to develop. Because the lungs can't get rid of all these dust particles, they cause inflammation that can eventually lead to scar tissues. The types of pneumoconiosis depends on the type of dust that is inhaled. First is anthracosis. This is caused by inhalation of carbon dust. They are endemic in urban areas and causes no harm. Carbon-carrying macrophages results in irregular black patches in the lung. Next is coal workers' pneumoconiosis. This is caused by inhalation of coal dust containing both carbon and silica. Simple coal workers' pneumoconiosis is called black lung disease. They are marked by coal macules around the bronchioles due to ingestion of coal particles by macrophages. They are inconsequential and produce no disability. However, progressive massive fibrosis is marked by fibrotic nodules filled with necrotic black fluid. They can result in bronchiectasis, pulmonary hypertension, or death from respiratory failure or right-sided heart failure. Third is Kaplan syndrome, which is pneumoconiosis with rheumatoid arthritis. Fourth is silicosis. It is caused by exposure to free silica dust seen in miners, glass manufacturers, and stone cutters. It is due to ingestion of silica dust by alveolar macrophages, which initiates inflammatory response mediated by lysosomal enzymes and chemical mediators. It is marked by silicotic nodules in the upper lobes that enlarge and obstruct airways. They may develop into massive progressive fibrosis. They increase susceptibility to tuberculosis, frequently referred to as silicotuberculosis. Fifth is asbestosis, which is caused by the inhalation of asbestos fibers. It is due to the ingestion of asbestos fibers by alveolar macrophages. Fibroblastic response occurs due to release of fibroblastic growth factors by macrophages, leading to diffuse interstitial fibrosis in the lower lobes. Ferruginous bodies are yellow-brown, rod-shaped bodies with club ends that stain positively with Prussian blue from iron and protein coating of fibers. Dense fibrous calcific plaques of the parietal pleura are also present. There is increased predisposition to bronchogenic carcinoma and malignant mesothelioma of the pleura or peritoneum. Cigarette smoking further increases risk for bronchogenic carcinoma. There is an increased risk of laryngeal, stomach, and colon cancer. Family members also have increased risk of cancer. 6 is perilosis, which is caused by beryllium exposure. It is due to type 4 hypersensitivity reaction resulting in granuloma formation. Genetic susceptibility is a factor. Acute exposure results in acute pneumonitis. Chronic exposure results in pulmonary non-caseating granulomas and fibrosis, hilar lymph node granulomas, and systemic granulomas. Lastly, diacetyl, the compound used to give movie popcorn its buttery flavor, also can lead to the disease. This is known as popcorn lung. Pneumoconiosis can be simple or complicated. Simple pneumoconiosis causes a small amount of scar tissue. The tissue may appear on an X-ray as round thickened areas called nodules. This type of disease is sometimes called coal workers' pneumoconiosis or CWP. Complicated pneumoconiosis is known as progressive massive fibrosis or PMF. Fibrosis means that a lot of scarring is present in the lungs. For either simple or complicated pneumoconiosis, the damage causes the loss of blood vessels and air sacs in the lungs. The tissues that surrounds the air sacs and air passages become thick and stiff from scarring. Breathing becomes increasingly difficult. This condition is called interstitial lung disease. Symptoms of pneumoconiosis often depends on how severe the disease is. Simple CWP may have no or few symptoms but show up only on an X-ray. PMF may cause mild to severe difficulty in breathing. Symptoms may include cough, lots of phlegm, and dyspnea. What are the risk factors of pneumoconiosis? Being exposed to dust that can cause pneumoconiosis in an everyday setting is not enough to cause the disease. Work-related exposure to coal dust, asbestos, fibers, or silica increases the risk. Risk may also be increased by smoking, being exposed to high levels of dust, and being exposed for a long time. What are the complications of pneumoconiosis? They include 1. Progressive respiratory failure, 2. Lung cancer, 3. Tuberculosis, that is now rare, and lastly, heart failure caused by pulmonary hypertension. Prevention of pneumoconiosis is important because there is no cure and it's irreversible. They include 1. Wearing a mask, 2. Washing areas of skin that come in contact with dust, 3. Safe removal of dust from clothing, 4. Washing face and hands thoroughly before eating, drinking, or taking any medications, 5. Not smoking, and lastly, getting regular chest x-rays and physical exams. Diagnosis of pneumoconiosis is by symptoms, x-ray abnormalities, and a history of working around coal, asbestos, or silica. Other methods include personal history of work exposure, physical examination, chest x-ray or CT scan to look for lung nodules, masses, and interstitial disease, CT scan of the chest, pulmonary function studies including blood gases, and lastly, biopsy. Pneumoconiosis can't be cured. Once diagnosed, treatment is to keep it from getting worse and controlling symptoms. First is to quit smoking. Second is to avoid all dust exposure. Third is to use oxygen. And lastly, to take bronchodilators to open lung passages. This ends our discussion on pneumoconiosis. See you next time when we discuss various pulmonary vascular disorders, starting with pulmonary hypertension.